A very good evening to you, esteemed viewer. I send my greetings to people who buy maize in the evening and walk while eating. Well, I don't want to shake tables. I might not be able to buy the drinks there in. But anyway, we welcome you to Family Hour, empowering families one episode at a time. Here we are with our Tuesday edition where we discuss health. Of course, today we are looking at something. It seems strange to very many people out there. We know that. We know that some people are still stuck with what to do because it is something new on board. Of course, the Ministry of Health is sensitizing, especially parents, to take their children to be immunized, to be vaccinated against malaria. I think this is something we are hearing for the first time for the first time we are hearing malaria vaccine. Of course, parents were told that when you take your child for immunization, they'll also vaccinate them against malaria. And we grew up knowing that sleep under a mosquito net, clear the bushes, and all those were things that we were told to do. Now things have changed, but also to know that malaria is one of the leading killer diseases here in Uganda, and of course countries of our level. I don't want to say developing countries, but countries that at which we are on the same level. But today we want to get to the deeper understanding of this vaccine. How does it work? How is it administered? And what its impact is, especially to our population as Uganda. With us is someone who has been here before, and it has been a while without having him, but we are glad he's back here, and we are sharing, of course, on his expertise, Dr. Ssekawu Barnabas. It's a pleasure having you this evening.
Yes, thank you very much. To our viewers, good evening. We'll be back to those who are home and to those who are still at work. Well done with all the endeavors. Sure. It has been a while, and I thank God that back again I'm here to share a little science with our viewers.
We are excited especially with our topic today, that, like I said in the introduction, that it sounds a little strange to very many people. Up to now, we have people who are still stuck. They don't even know whether to believe this vaccine or not. You know, there is this analogy that keeps on coming each time there is a new vaccine, that abazungu bagala tuta, so there are parents who believe that maybe this is an avenue through which their children will be, maybe, I know. So anyway, there are some vaccines reduce our life expectancy. I mean, there are a lot of myths that surround vaccines. And now, worst of all, this vaccine that sounds new to most of the Ugandans. Maybe you in the health field, you might have heard about it, but now we, the lay people, we're hearing this for the first time. Of course, it sounded fancy when they said they're coming up with a malaria vaccine, and now that it is here, everyone is afraid. Not my child. But first, tell us about this vaccine, and probably the history and the statistics of malaria in the country. I think that will give us a basis on whether to believe or not.
Well, thank you very much. Actually, the topic that you brought, it is two-parted. Let me first give our viewers a preamble of what is happening lately and in the realities of our communities. Well, as we all know, malaria is a protozoal infection that is transmitted from a person to a person by an infected Anopheles female mosquito. If we talk about protozoal infection, we have various infectious agents that transmit or that cause diseases. Name to mention: fungi, bacteria, viruses, protozoa, and many more. So malaria takes the shape of the protozoa. It is a protozoa infection, as I've mentioned. But I
remember that word in senior one, protozoa. I'm away by those things. I don't even know how.
I want to build up the case such that our viewers can explicitly understand what we're talking about. malaria has been in the continent, in the universe for decades of time. Actually, Italians in the 18th century first thought that it is caused by bad air. Actually, that's where the malaria gets its name as malaria. Malaria is an Italian word. Mal meaning bad. Alaria meaning air. So they had a notion in the 18th century that malaria is caused by bad air that was coming from the sewers, from the swamps that were surrounding the communities. Not until in the 19th century when an advancement came and it was declared that this is actually a parasitical or a protozoan disease. Going back to what you asked, we've had a breakthrough in public health. Malaria being one of the leading causes of deaths in Uganda. Actually, every day 16 people die.
Every day?
Of this malaria.
Every day?
Every day. It means that and actually of the 16, 10 are under 5s.
That's unfortunate.
So, the most vulnerable group to this disease, all of us are susceptible, but the most vulnerable group is under 5s and pregnant women. So if every day 10 under 5s are dying, it means that in a year of 365 or 66 days, almost 3,650 infants or under below 5s are dying. So having gotten this magnanimous step of the vaccine, it is totally true that is going to help our communities get more better.
You talked about, before we even get into the vaccine, you talked about how it is spread from one person to the other. And I think that needs to be clarified more. You know, we live in communities and people, and I mean, the people have even tagged some mosquitoes. So probably people have even lived confident enough to even differentiate those that transmit malaria and those that don't. So what is the science surrounding the spread of this disease?
Actually, you're very right. Because our people need to clearly understand.
They'll tell you, buno butone nnyo bwe bulwaza, bino ebinene tebirwaza, bino ebinene bisajja tebirwaza.
The truth is, malaria as a disease is transmitted by an infected female Anopheles mosquito.
Only female.
Males are vegetarians if they are people. Males only feed on green leafy stuff.
Not blood.
Not blood. Females, they need blood in their, we call it, in their life cycle of egg implantation, of egg development. When a female infected Anopheles mosquito gives you a bite, it disposes sporozoids. These are infective units. So if these sporozoids go into your blood, they travel to the liver, they multiply, then they become merozoites. After becoming merozoites, also they multiply and they become trophozoites. If they become trophozoites, then they multiply, they go into the red blood cells, then this mosquito, it goes to come and gives you another bite to pick that infected blood. This infected blood, it is going to be transmitted to another person. That is a little of its life cycle. So to clearly answer what you've asked, it is a female infected Anopheles mosquito. You have actually different types of mosquitoes. You have the AIDS, you have the Turex, you have various of them. But the Anopheles is the one that transmits malaria. So
is there a way I can know that this one coming is an Anopheles, a female Anopheles, or this one coming is a male?
Actually, those that always are in the households and in the environment are particularly females. You might not differentiate at our macroscopic view of things. You cannot differentiate whether this is Anopheles, this is AIDS,
whether
this is Turex,
whether this one is male or female.
Yes, and actually, in Africa, we have various strains of these parasites. Because as I've told you, a mosquito, female infected Anopheles, is the one that transmits, but it doesn't mean that it's the one that causes. The causative agent, or the very infectious agent that causes malaria, we call them Plasmodium organisms. So the mosquito carries Plasmodium. We have various forms of Plasmodium. The vivax, Falciparum, ovale, knowles, but the most virulent in Africa and in Uganda in particular is the Falciparum. So this vaccine targets the Falciparum. And actually this drives us back to the notion you brought surrounding the vaccines, the myths, the misconceptions, the controversies that surrounds.
Actually, before we get into the myths, that's where we're going to head. But tell us the history about our history of these vaccines. Have they existed in other countries? Is Uganda the place where they are going to test these vaccines from? Where do they come from? Who produces these vaccines?
Thank you very much. Vaccine development takes a lot of systematic scientific stages before a vaccine is fully produced and it is fully allowed to go in the populace. Uganda is among the 17 countries that are going to start the vaccination. Almost all countries in the Central African region, in the West African region, they have started this vaccination with the same vaccine. And as I've told you, the World Malaria Report of last year that was done by World Health Organization noted that in the most 26 countries with the most malaria cases, Uganda is ranked third, after Nigeria and DRC. So Uganda taking this milestone of starting vaccinating, it is actually of our good benefit. So back to what you've asked, this is not going to start in Uganda. It has already started in other countries. Actually, even in Kenya, they started vaccination of malaria. So this is a step that is going to take us a far mile.
Now we get to the myths and misconceptions. Why do people, I'll talk about Ugandans because this is where I dwell most of my time. Why do we fear vaccines? And also speaking to you as a Ugandan, sometimes you take off the other medical shield and then you look at yourself as Ugandans. Why do Ugandans always create theories and myths around such things, especially vaccines? And why do we always fear vaccines?
True. One of the causes of such is the misinformation that always surrounds vaccines, vaccine formulation, vaccine distribution, vaccine administration. Many people think that Westerners or the whites are trying to depopularize Africans.
So they can come and live here.
And such that they can come and live here. Actually, you see, the whites have always been here. Time immemorial. They have not taken us from here. They have not taken our countries to their countries. So it means that is a myth, that is a controversy, that is a misconception.
Actually,
people from
quoting the Katikiro of Uganda, one time he said, if those people wanted to kill us, they would have put the poison in paracetamol because at least everyone takes that.
Yes, that's very true, because you see, this myth, actually that is the most dangerous item that bars people from coming up for these vaccines. That's why I thank you people for having brought this topic up. We're trying to sensitize people that look at this. This is not to depopularize Ugandans. This is going to help us prevent. Because as I'm going to tell you, this vaccine acts by producing antibodies against the malaria antigen. Which means that we have what we call levels of prevention of a disease. Levels of prevention are absorbed by the natural history of a disease. Natural history of a disease just means the progression of a disease without any medical interference, no public health intervention. This informs us the levels of prevention, where you have the primordial, the primary, the secondary, and the tertiary. This vaccination is anchored in the primary prevention. Primary prevention means combat the disease before it happens, actually. So if you get injected by this R21 vaccine, the body will synthesize antibodies.
It's called R21.
R21.
Why R21?
Why R21? These are nomenclatures that are given by the manufacturers. So R21 is under RTSS, but the vaccine here that we received, actually, the ministry already dispatched almost 2.3 million doses to most prevalent malaria areas in Uganda. This is going to actually start, the vaccination is going to start in April. Because it is going to be integrated into the normal childhood immunization schedule. And at every 6, 7, 8, and 18 months, these children will always get these doses of vaccines.
How many times are they supposed to get the doses?
There are 4 times. People should know. One at 6 months. The second dose at 7 months. The third dose at 8th month. And the last dose at 18 months. Yes. But actually, this doesn't mean that you are completely covered from being affected by malaria.
Yeah, I was about to say that now when you tell someone take their child for vaccination, they'll vaccinate, they'll get they'll get the 4 doses, and then it's so you know that Nate has been irritating my child, and you know so they'll forget about the other measures.
Actually, that is not right. That is also another myth surrounding vaccination, as you've said. We need, if you go for vaccination, that is very good, and we advocate for it, but you also need to take in action the other preventive measures. We used it to know. Sleep under-treated mosquito net, conduct good sanitation at home. If you see dumplings, if you see drained, stagnant water in place, clear it off, clear the bushes, wear long-sleeved clothing at night, because we've seen cases people wear short clothing. These are behavioral methods.
Some don't even put on clothes. They put on half clothes.
And mosquitoes then bite you, then you get infected by malaria. Actually, malaria is one of the diseases that not only compromises health, but also compromises the economy of the country. Because on average, most cases that I know hospitals bedridden, 6 out of 10 are malaria cases. Because yes, malaria and complicated, and actually on average, people spend in private settings to treat uncomplicated malaria. A person might spend around 100 to 200 on uncomplicated treatment. Look at that. So if you do these preventive measures, you'll have saved that 100 to 200 shillings. 100,000, right? So you see, malaria doesn't only compromise our health, but also it compromises the economics of us. Yeah, that's why you need to gear up.
So we get back to the vaccination. We are looking at under 5. So what if, because someone might say, my child is past 18 months, do they still qualify for this vaccine?
No, that is not in our recommendations. The recommended doses are at the 6, 7, 8, and 18 months. For the above 12, for above 18 months, we need to take these behavior changes I've talked about to see how best we can control malaria. Yes.
So meaning
the vaccine is at 6, 7, 8, and 18. Above 18, no dose.
Are there any side effects associated with this vaccine that a parent might expect? You know, in hospital they tell you, you'll get some headache. Someone was telling me they were given some tablets and they told them, please, you're going to get nightmares, but don't worry, that is part of the side effects. And then we've also seen children taking vaccines, and then they get swollen thighs and things like that. I think parents, generally parents fear to take their children for immunization and vaccination because of the unrest that the children get after the vaccination.
Well, the R21 vaccine is safe, efficient, and efficient. But as we all know, for every remedy, for every medicine, there is what we call side effects and adverse effects. So for ALA21, it is already produced after undergoing vigorous scientific investigations and measures. No known adverse effect. Actually, one would worry for adverse effects. Adverse effects means that these effects after immunization, after vaccinations, are too severe. But these minor side effects like a redness of the injection site, a little pain, those are expected.
Then, because, for example, there was a time as we were growing up, we had stories that there was a particular vaccine, I think it was for polio, and I think from then parents fear to take their children for immunization, and I mean for vaccination, because it's alleged that after taking that vaccine, every child that took the vaccine became lame.
Well,
it's a story I also grew up hearing. I didn't live to witness this. And some people have their children with maybe crippled legs or hands, and they allude it to that vaccine.
Well, if a vaccine causes such, we always have a case reporting advanced side effect reporting systems. We always note them. We report back to relevant authorities. Relevant authorities might recall this vaccine or might do other steps to combat the spread of such in communities. But for this ALA21, it is safe, efficacious, and effective.
Before we go for a break, you know, when we talk about vaccines, you have to convince people so much. Someone would really ask, because you told us that what it does in the body, it builds antibodies. But now someone would ask the other question: why does my child have to take it 4 times? Why not 2 or even once?
Well, thank you very much.
And to those antibodies enough to fight malaria.
No. It's actually, that's why when you come to hospitals, they always tell you this medicine, take it after every 6 hours, after 8 hours, for this given period of time. We need to reach a threshold of antibodies to combat any dose of antigens from Plasmodium. That's why we tell you come for 4 complete doses, such that we reach at a threshold level of antibodies building up in your body to fight the antigen that will be given by the Plasmodium. So we need to complete the dose in other ways. Okay. We need to adhere and we complete the 4 doses, not just taking 2, taking 3, because the more you take less, we shall not reach the threshold, we shall not reach the minimum level of antibodies needed to fight back the Plasmodium antigen.
Then, still in the same development, a child takes it at 6, at 7, and at 8. Then they will rest for almost 9 months before they can take another vaccine, or the last dose. What happens between that time? Why are these ones so close, and then this last one, they have to take some long period before they can take?
That's very right. Because we need to see the vaccine development in your body. How will the body react after? How will you be susceptible to get this infection? All of those are come in play to give the spacing of these vaccines. It is not a one factor that you have to get it at a constant pacing of time.
Because, you know, when you take it, when you tell a parent to come back after 9 months, some have even forgotten about it, some have even moved on. I mean, people will always have different reasons as to why they excuse themselves from bringing their children back for the vaccination. But let's take a short commercial break. When we return, we are going to continue with the talk, especially on this vaccination. We are giving it a lot of time because it is something new to us, so we really need to understand it before it can sink in our heads. We need an explanation. So we are coming back shortly. Stick with us. welcome back from that commercial break. Here we are talking about the malaria vaccine. We want to look at its impact, especially in our population, because we know that malaria is one of those killer diseases, whose numbers are higher. So, of course, the prevalence is more in pregnant women and children that are below 5 years. Now, this is something that has come especially to safeguard the children. Is there any provision for pregnant mothers? Because they are also at risk.
Well, there is what we call chemoprophylaxis in antenatal care for where we give pregnant mothers Fansida. This at least gives them protection against the plasmodial infections of malaria. For the vaccine, they are out of it. The vaccine is for under 5s, but for pregnant mothers, at least there is that, and the provision of them sleeping under treated mosquito net.
So a mother don't go and claim for a vaccine. No, mujinkube kulwa mwana wange ali munda, please no.
Actually, you see, there is a point I wanted to remind viewers about the transmission. People think diseases are transmitted sexually. Malaria is not. Though, if you have you intend to have sex not under a treated mosquito net, mosquitoes will bite you.
So they bite you, and they bite you, and then
definitely.
you all.
So we need to have quite a standard protected environment also.
So, mosquito nets. Let's talk about the importance of mosquito. You know, there are mosquito nets that the government gives out. And people don't want to sleep in them because they say the chemicals are so strong in these mosquito nets, and then people prefer these mosquito nets they buy from textile shops or streets, wherever. But what is the difference between these ones that turn into gardens, small gardens and chicken houses?
The truth is, actually, even last year, the government of Uganda, with other supporting partners, had a campaign which they called the universal distribution of mosquito nets across the region. And people received them. Only that there is a myth that when you sleep under such a net, you'll feel itchy.
Yeah.
Sort of. That is not true.
Some people say we suffocate.
Others. The right thing is, if they give it to you now, and you don't put it under a heat environment, under sun, and you just sleep in it there and then, the polymers, the chemicals, the substances in those nets will definitely give you that rashes, sort of. But the right thing to do is, if you're given this mosquito net, you need to first, at least for 24 hours, put it under direct sunlight, such that at least you can use it safely.
Okay.
Yes, but there is that knowledge gap. People don't know that after receiving them, there is something you do before.
Now, talking about the vaccine, should we assume that now that we have this vaccine here with us, and it is now going to be among the immunizable, among the doses that a child gets, should we assume that we shall not have any more malaria-related deaths among the infants?
No. Actually, as I've said, and actually as you related it, this vaccine is not 100% giving us a go that malaria will go. We need to supplement the vaccine with other behavioral measures of malaria prevention. Say the vector control methods, say the chemoprophylaxis I've talked about of Fansida, say the environmental sanitation of removing the bushes around us, of indoor spraying of the pesticide. Look at that. So this vaccination doesn't warranty us that we're going to have a Uganda-free malaria. We need to supplement and complement it with other methods of disease prevention that have been in place. Yes. That has to be taken note of.
Well, talking about this vaccine, we now want to look at its impact, especially on our population as a country, because you realize that we've lost very many valuable, would be valuable people in this country because of malaria.
True, as we say, malaria, if complicated, even if not complicated, it kills people. One of the many of complications of malaria include anemia, include kidney failure, include respiratory distress, include hypoglycemia, include bleeding, spontaneous bleeding. All cerebral malaria, all of these precipitate to death. Right? So it means that one of the major challenges of having malaria in our communities is deaths, malaria-related deaths. So impact of this vaccine to our community, to our Ugandan population is it will definitely reduce the morbidity, the mortality of malaria in our communities. And two, as I've said, malaria cases management, case management of malaria takes a lot of money. If we manage it at a primary level, definitely we shall save this money. We shall have a working population which is not sick. As you saw the UBO statistics that told us that almost around 82% of Ugandans are in the working class. It means that if this working class is okay, they will be able to work. They will be able to support the dependent groups of below 15 years and of above 65 years. They will always contribute to our GDP because they will be healthy. So you look at that. It starts as a vaccination. In a long run, it reduces the mortality. It increases life expectancy of individuals. It will have a healthy environment, and people will work. People will develop their country.
One of the other challenges associated with any disease, and this is also common with malaria, is self-medication. We know parents who have been told that when your child has some temperature and this, give them this and this and this, or buy them these particular tablets before they go to hospital. Or maybe try this and this. I mean, they have been told a lot of things, and because they're desperate, they end up using them, not knowing that probably this is only worsening the situation. So what are some of the dangers of this particular?
Actually, one of the major vices we have in the health care system now is self-medication. This self-medication, one, it mimics the disease. It destroys the internal organs, because one might be taking a drug not knowing its indication, not knowing its association with other drugs. We need not to self-medicate, because now we are seeing increase in antimicrobial resistance because of self-medication. We are seeing organ failure because of self-medication. And if I take you back, malaria has 3 classical stages. There is what we call the cold stage, where one first feels very cold.
And you shiver.
You shiver.
You cover yourself.
There is that hot stage, where one feels too hot. There is a sweating stage. But if you try to self-medicate with any anti-malarial, this anti-malarial might mimic any of the stages. And this leads to very rapid progression of the disease, right? So actually, the point that you brought of self-medication should be out of the context of malaria case management. People should go seek for right medication. People should first go seek right guidance from professionals, such that they can take preemptive stages and phases in their treatment.
Okay.
Yeah.
We also have facilities, clinics that will tell you that you have malaria, and they give you even a prescription of medicine, when in actual sense it was something else. Maybe it was fatigue, but because they want to, allegedly they want to get that money also out of you, so they give you these tablets. So what happens if I take maybe anti-malarials when I do not have malaria? Isn't it harmful to my body?
It is very harmful. Because anti-malaria, as you hear it, it is against malaria. Malaria being caused by Plasmodium species. Now, and actually, as I told you, every drug has its side effect. Now you are taking a drug that has no relevance into the body. It means that you're going to have a toxicity into your body. What might end up to have liver issues, kidney issues, because this drug will be eventually metabolizing. And you get various issues just because a health worker wrongly prescribed, or just because you just went and took drugs by your own guidance. You
go to the pharmacy and tell them, give me this and this and this.
The right thing to do is, if you feel like malaria cannot be empirical. You cannot just sense that this is malaria. You cannot just be like, this is how malaria starts to progress in our family. No. That is, you need to first go in the health care setting, professionals. They do some tests. We have rapid diagnostic tests, majorly for aspirant. We have the blood smear, the thing for identification of the parasites and the thing for quantification of the parasite, such that they can prescribe rightly and you get better. Because if you lay at home, eventually the disease will progress. What will happen? The complications we talked about. What will happen? Death, ambiguity on the body, handicapness of the body, disability on the body, and you lose out of going to work because you're sick. You didn't take precautions in the first place.
Okay. Yeah. What about, we have a category of people who believe that when I take my herbals, they even know which concoctions they mix, this and this and this, and then you take a cup, and then you cover yourself, you take another one at around 3 a.m., you sleep again, the following day you'll be okay.
You see, you cannot merely treat a symptom and you'll be okay. These concoctions, the alternative medicines, the remedies they use, they just suppress a symptom. They don't go to a root cause. They don't kill malaria parasites. No, that is not right. They just suppress the symptom of being too feverish, of having joint pains, of not having appetite. But in the actual sense, when you haven't taken the root cause of malaria. So the alternative medicine, it is good when advised by health professionals. It is good when you have actually known what is in your body.
Now, this has been a concern. The vaccine, getting back to the vaccine, the vaccine is supposed to be administered to a child who is below 2 years.
Right.
Those are 18 months. That is 1 year and about 9 months.
Right.
But why do we now call it under 5s? Why don't we call it under 2s? Because past 18, you don't get the vaccine.
True, the nomenclature is under 5 because that is the commonest terming. Actually, child ends at 5. If a child kicks a 50th birthday, then below 5, this is the major susceptible group. It is too vulnerable to be protected. And under 5 is the most common nomenclature, not under 2s. So under 5s is pronounced more better than under 2s. Yeah, and actually it is this grouping of under 5 that we take as a denominator in indicators of infant mortality, in indicators of childhood health. So that's why we take of under 5s, but the dosing ends at 18. Yeah.
So what happens if I really want my child to get the dose, but they are past 18 months? Maybe they are 2 years or 2 years and some 3 months, but I come and I tell the health worker that, my child is 17 months. What happens if they take that dose?
Well, documentation is at 18, but one might lie because he or she wants the kid to get the vaccine.
Yes.
Beyond that, the ministry will guide better. Guidelines will come, I know. Statutory instruments will be made about this to see how best we can address such an issue, because people might lie in favor of them getting the vaccine.
They will, not they might. Me, I know Ugandans. They will.
But the right thing is at 18 years, rather at
18 months.
Yes, yes.
And you know, we also have a category of parents who don't even follow those things. 18 months, for them, you better tell them 1 year and 9 months. So they will understand better when you say that. But now you say 18 months, someone will say, you'll find someone bringing someone of 5 years. And they'll tell you this one is not 18 months.
But the right thing is that actually, yes, because you're right, these are things that debar people from getting the vaccine. People not knowing the terms that we use. And actually that is right. People should actually know that 18 months is 1 year and a half. Right? 6 months, 7 months, 8 months. Yes.
Otherwise, but as we draw closer to the end of this discussion, still about this, is there a special consent that a parent is required to fill before their children can be immunized, or as long as you go to as long as you take your child for immunization, it is compulsory, they have to go through the same chart?
Well, as we've said, the integration of this vaccine, malaria vaccine, is going to be rolled out in April. So from April, the childhood routine immunization schedule, the malaria vaccine is going to be on the chart. But it is a right of a parent to consent. This is not a mandatory vaccination, though we should take it as something instrumental in disease prevention. And I think no one should deter a health worker from vaccinating his or her kid, provided that this child is in the range we talked about.
Okay.
And every one of us actually should play a vital role in advocacy of vaccination against malaria, because of the consequences and the burdens they put on our health care, they put on our economy, they put on our social structures.
Someone would say, Apple is already with us here. And what if my child is 9 months or 8 months? Will they still get the first dose?
They will get the dose at that age. They are past 6. The child is now 8 or 7 or 9 or rather, yes, 9 or 18. They will get the dose at that age.
So if someone is 18 months, do they get one dose, or they also have to get, 18 months. Do they get the only one dose because they're 18 and past 18, they're not supposed to get a dose, or they have to complete the dose and wait for another past?
Actually, this vaccination doesn't work retrospectively. It's a prospective way of prevention. So if the kid is at 18, he or she will get that one dose at 18. Not retrospecting
that you go back and
to 7 to what? No. It has at 18 one dose. Yes.
So what I'm looking at is, so what happens to the antibodies that they need in the other, out of the other 3 doses?
As we grow up, even the natural immunity goes on being more stronger. So the more we grow, the natural immunity grows better. So it is too right that even though you've gotten one dose, it has reached at 18 months. It has come in the body that is already a bit grown up. You look at that. Yeah. So that is the science in between them.
Well, as we wind up now, give us your closing remarks, but also to encourage parents to take their children willingly for this immunization or this vaccination because of the benefits that come alongside the vaccine.
Thank you very much, the host and the organizers of the show. One, the R21 vaccine, the malaria vaccine is safe, free, effective, and efficient. Let one tell one, let us all embark on the constructive way of preventing malaria in Uganda, such that at least at the end of the time we reduce the prevalence of this disease in our country.
Okay. Thank you so much. Unless there is a katalekeka.
Let actually address the culture, the religious, and the stereotypes that surround vaccination.
Okay.
Yeah, many people, there are some religious beliefs that debar people from using phones, from taking kids to school, from taking them for immunization. These cultural, inconstructive theories should
and the
be
cultic.
taken away. Yeah, they're very cultic.
Yeah.
So they should be addressed to have a malaria-free world, a malaria-free Uganda, and we see how best we can develop our country.
Thank you so much, Doctor, and thank you so much to you, our viewer. It's been a pleasure having you now that we know that the vaccine is here, and so you take your child for their own goodness, because I know our children are exposed to mosquitoes. You might say that me, I'll take the other preventive measures like keeping my children under mosquito nets. But what happens when you're having dinner in the evening before they go to bed? I mean, there are a lot of exposure to mosquitoes, so it's better that we build their bodies, their immunities, by taking them for vaccines, especially those who qualify. The vaccine is free of charge, therefore do not put in a lot of feeding. Take your child willingly, and of course for the good of their child. Probably this is one of the measures that we can control or reduce infant mortality rates. Thank you so much once again for watching. Edrine Mukalazi is my name. I've worked with Didmas and Jonan, and from the entire team, we wish you a blessed night.